Introducing the Posterior Sickle Scaler S204. This instrument is used for supragingival calculus for posterior teeth. To find the correct working end, I'm going to hold the instrument towards the distal surface of the tooth I'm going to scale. You can see that the lower shank is parallel to the distal and the functional shank goes up and over the tooth. You can also see that the V or bend in the shank is pointing towards the distal, which confirms this is the correct working end. If I flip it to the opposite end, the shank is crossing over the tooth and that V is pointing towards the mesial, which is not correct. I'll be demonstrating on tooth number 30 and 31. Before I begin, I'm going to make sure that I have a modified pen grasp, good ergonomics, and I have an intraoral fulcrum. I'm going to start by engaging the tip third right at the distal buccal line angle and establishing a 70 to 80 degree working angulation. I'm going to use a wrist activation with short, controlled, overlapping vertical strokes, working my way towards the distal interproximal, going 51%, which is halfway into the distal. Once I scale the distal surface, I'm going to re-engage the tip third, staying supragingival. Now I'm using an oblique stroke across the buccal surface with short, controlled, overlapping oblique strokes. As I come towards the mesial line angle, I'm going to roll the handle between my index and thumb. I'm going to stay adapted, maintain my modified pen grasp, start to roll into the mesial interproximal using a short, controlled, overlapping vertical stroke, going 51% into the mesial interproximal. Now I'm going to scale tooth number 30. I'm going to adapt the tip third using a 70 to 80 degree working angulation, modified pen grasp, wrist activation with short, controlled, overlapping vertical strokes going 51%. I'm going to do a quarter turn, re-engage the tip third. Now I'm using an oblique stroke across the buccal surface with short, controlled, overlapping oblique strokes with a wrist activation. As I come towards the mesial line angle, I'm going to roll the instrument between my index and thumb, stay adapted, maintain my modified pen grasp, and now I'm going to roll into the mesial using a short, controlled, overlapping vertical stroke going 51%.